AHA PALS Exam Actual Exam Test Bank. Question 1. A 5-year-old child presents with lethargy, increased work of breathing, and pale color. The primary assessment reveals that the airway is open and the respiratory rate is 30 per minute, with crackles heard on auscultation. The cardiac monitor shows sinus tachycardia at a rate of 165 per minute. The pulse oximeter displays an oxygen saturation of 95% and a pulse rate of 93 per minute. On the basis of this information, which of the following provides the best interpretation of the oxygen saturation of 95% by pulse oximetry? A. Reliable, no supplementary oxygen is indicated. B. Reliable, supplementary oxygen should be administered. C. Unreliable, no supplementary oxygen is indicated. D. Unreliable, supplementary oxygen should be administered. Correct answer: unreliable, supplementary oxygen should be administered. Question 2. A 3-year-old child was recently diagnosed with leukemia and has been treated with chemotherapy. The child presents with lethargy and a high fever. Heart rate is 195/min, respiratory rate is 36/min, blood pressure is 85/40 mm of mercury, and capillary refill time is less than 2 seconds. What is the child's most likely condition? A. Septic shock. B. Hypovolemic shock. C. Significant bradycardia. D. Cardiogenic shock. Correct answer: septic shock. Question 3. A 2-week-old infant presents with irritability and a history of poor feeding. Blood pressure is 55/40 mmHg. What term describes this infant's blood pressure? A. Hypotensive. B. Normal. C. Hypertensive. D. Compensated. Correct answer: hypotensive. Question 4. During a resuscitation attempt, the team leader orders an initial dose of epinephrine at 0.1 mg per kilogram to be given 10. What should the team member do? A. Administer the drug as ordered. B. Administer 0.01 mg per kilogram of epinephrine. C. Respectfully ask the team leader to clarify the dose. D. Refuse to administer the drug. Correct answer: respectfully ask the team leader to clarify the dose. Question 5. Which of the following is a characteristic of respiratory failure? A. Inadequate oxygenation and/or ventilation. B. Hypotension. C. An increase in serum pH, alkalosis. D. Abnormal respiratory sounds. Correct answer: inadequate oxygenation and/or ventilation. Question 6. Which of the following is most likely to produce a prolonged expiratory phase and wheezing? A. Disordered control of breathing. B. Hypovolemic shock. C. Lower airway obstruction. D. Upper airway obstruction. Correct answer: lower airway obstruction. Question 7. A 4-year-old child presents with seizures and irregular respirations. The seizures stopped a few minutes ago. Which of the following most likely to be abnormal? A. Vascular resistance. B. Pulse rate. C. Lung compliance. D. Control of breathing. Correct answer: control of breathing. Question 8. What abnormality is most likely to be present in children with acute respiratory distress caused by lung tissue disease? A. Decreased oxygen saturation. B. Stridor. C. Normal respiratory rate. D. Decreased respiratory effort. Correct answer: decreased oxygen saturation. Question 9. An alert 2-year-old child with an increased work of breathing and pink color is being evaluated. Heart rate is 110 per minute, and respiratory rate is 30 per minute. What would best describe this patient's condition? A. Respiratory distress. B. Respiratory arrest. C. Respiratory failure. D. Disordered control of breathing. Correct answer: respiratory distress.